So we are going to discuss the posterior aspect of the right humerus. Observing the humerus posteriorly, we notice that it has three parts. Again, the head or the upper part, the shaft, and the lower end. Now, at the upper end is a prominent head, again articulating with the glenoid fossa of the scapula bone. You can see the lateral tubercle. We can also observe the anatomical neck separating the head from the rest of the upper portion, and there is also a surgical neck. The surgical neck separates the whole of the upper portion of humerus from the shaft of the humerus. Now, this is called the surgical neck because, in cases of fracture of the humerus bone, surgeons have observed that this part is most commonly affected. Now, coming to the shaft of the humerus, from the posterior side, we can only view one aspect of the humerus, that is the posterior aspect or the posterior view or the surface, and two borders out of the three, the lateral and the medial borders. The shaft of the humerus posteriorly has two very important features. One is the deltoid tuberosity. It is where the deltoid muscle gets attached. We will discuss that later on. The second part is the groove for the radial nerve. Again, a very major nerve in the arm. Now, discussing the lower end, we have the lateral epicondyle, the medial epicondyle, and the olecranon fossa. This olecranon fossa accommodates the olecranon process of the ulna bone, which comes towards it in case of extension of the arm.